The beginning of a new year is a good reminder that we should take better care of ourselves, and our next guest has many ways to help us do just that. Let's welcome back to the table Tangi Perry with IV Restorative Care.
Hello, everyone.
Tangi.
Thanks for having me.
Thank you for coming.
Yes. Thanks.
So many things have happened since you were here last. Do tell.
Okay, so last time I was here with my partner Cassie, and we do still have our advanced mobile IV, which is strictly mobile. We come to you.
Okay.
But in April, I decided to open another business.
Okay.
And so it's called IV Restorative Care, and my goal was to have restorative treatments for clients that were non-invasive, specifically to deal with incontinence in men and women.
Okay.
So what does that look like? What do you do for them?
So
It looks like sitting on this little machine.
Right?
It looks like you're going for a pedicure, but you're going to do something else instead, right?
Yes.
Okay.
It's true. So as I said last time on the when I was here, I went and got my wound, ostomy, and continence nursing. Only 9,700 nurses in the whole U.S. hold some form of that degree, and only 33.
That's awesome.
Only 3,300 have any type of education or certification in continence care.
Wow.
And I did home health and hospice for 15 years, and so I knew this was kind of a really big problem for people, especially for women. You know, we have our babies and we just don't talk about it.
Nope.
So when I was in search for myself of, you know, something that I could do to help my issues, I actually came across, it's called the BTL Imcella.
Okay.
And it uses high FEM technology. And so it's high intensity focused electromagnetic waves.
Okay.
So you literally sit on this chair, 100% clothed, non-invasive whatsoever. We chat for 30 minutes. It does 11,200 Kegels in a 30-minute session.
11,000?
11,200 Kegels, yes.
Holy.
That is crazy.
That's crazy.
So most of my younger mamas can stop crossing their legs after just the first treatment. And by the third treatment, they're jumping on the trampoline. Older people take a little bit longer.
Okay.
Clients that have diabetes, it's a little bit harder as well because a lot of their medications cause continence issues.
Okay.
So, but yes, it's a wonderful machine, especially for the elderly, you know, because a lot of things now are lasers, needles, and honestly,
Same-day surgery, right?
Yeah, same-day surgery with the mesh. I actually have a lot of women who have had the mesh that I still treat.
Okay.
I was going to say that. I've known some women that have had the mesh and then maybe not been super satisfied. Some yes, and some not so. Like they still have to train it a little bit.
Yes, so the mesh is great to, you know, hold up that bladder. However, a lot of your continence comes from your rectus abdominis muscles in your stomach as well as your pelvic floor. And so a lot of doctors forget to tell their clients, hey, you still need to strengthen your pelvic floor. So, yeah.
So when you said by the third time, do you recommend 3 treatments?
We
or
actually
more?
recommend 6 treatments.
Okay.
But a lot of my young moms really respond to the treatment really well.
Okay.
So, and I don't want you to spend more than what you need. So I always listen to the client and I'll say, okay, if you're feeling great, we're good. We'll do the 3 treatments. And then I say, you know what, if in a few months you start feeling like, oh, I need a quick treatment, just run in and let's put you on the chair.
And how often would they come?
So if you've done the 6 treatments, most of the time you only have to come back like once a year.
But I mean, trying to get up to the 6 treatments. Is it monthly?
So
every
twice
3
a
weeks?
week for 3 weeks or once a week for 6 weeks. Yeah.
Oh, okay, so it's
we
pretty
do,
quick.
Yeah, we do it. The quicker you do it, the better results that you see and the quicker you see it.
Okay.
And then how much are those treatments?
There we go.
So normally they're $300, but I actually got another machine just this weekend. I'm super excited to help with the rectus abdominis muscles, which also helps with continence. And so I'm doing a package actually. So instead of $1,800 for one of the treatments, you get $1,800. You get 4 treatments of the stomach and 6 treatments of the continence chair.
For $1,800?
For $1,800, yeah.
So what
Wow.
does the abdominal one, how does that connect?
So the abdominal machine is also high fem technology.
Okay.
And so you actually just put it, they're paddles, and it's used for either, you can do your hips and the Brazilian butt. We all want that, right?
Yeah.
But mainly I wanted this machine to focus on the abdomen. So this has been, there's many studies that have been done that have shown that it can help close the rectus abdominis muscle. Of course, it's not going to close completely because you have to have surgery for that, right? But we had a gentleman whose wife, he could actually fit both of his fists in the separation in the stomach.
Are you
From
kidding?
pregnancy?
Yeah, from pregnancy, just from separation.
I didn't know that this was even a thing.
Yeah, so it is, and people don't realize that your stomach has a lot to do with continence and other things. And
Did you know that I didn't know our stomachs were separated.
Yes.
So this isn't just for women either, right?
no, we do men, but just to finish that up, by the
Okay.
4th treatment, he could barely fit one of his fists in
That's
the stomach.
amazing.
So that's significant. But yes, this isn't just for women. We do men as well. So this is really big. We have urologists call us and treat men, especially after a prostatectomy,
Okay.
because they lose that resistance against the urethra and they become incontinent. And so by doing the pelvic floor, and yes, men have pelvic floors too, although they don't think they do. They do. It really does help with continence.
Well, I'm just even curious about the muscle separation because I didn't even realize it was a thing until really just a recent conversation. So that's super interesting. Okay, also on the spend, what about flex savings or health savings accounts?
Yes, we can take HSA, but we
Okay.
do not take insurance. Unfortunately, I feel like anything that's super awesome is not covered by insurance,
It's
right?
crazy, but it's true.
So, but I also have payment plans. I really
Okay.
work with people. My goal in my work is really to reach those people who would normally not be able to have these treatments.
Wow.
So if you
That's
need
super
some
awesome.
assistance, please come talk to me. I just want to be able to help you.
I love how it's non-invasive. Like you're not going in for surgery and you're out. You can't
Yeah.
pick up anything for 6 to 8 weeks, I'm sure, with those mesh surgeries, right?
Yeah. So one of my ladies actually had 2 mesh surgeries in a 5-year period, and she actually got a really bad side effect where her leg feels like it's burning all the time. And so they ended up having to take her mesh out, I think it was in July or August. And then we waited for her to heal, and she actually came in, and at that point she was completely incontinent. And I want to say incontinence is bladder leaks because a lot of people don't understand what that is.
Right.
So she actually had to wear an adult brief diaper all day long. And she came to me, and just as she was sitting down for her 4th treatment, she said, I am completely pad and leak free. And she said, had I known about this chair before surgeries, which it wasn't out yet, but she said I totally would have done this treatment before going under the knife.
Sometimes I just wonder, like our medical world that we're living in, like to go to the medication or to go to the surgery, and there's other options out there.
There is.
Yep.
Yes. And that's what I wanted to, because another one of my clients had the laser done, and it actually scarred her uterus. And so because they had the laser up too high. And I'm not saying anything bad about these treatments,
course
because
not.
they have their place. They really do. But this is just, it significantly helps. Non-invasive. You're literally, your clothes are on. With the stomach one, you do lift up your shirt because we want it against the abdomen muscles. And yeah, it really does help. I think people get confused because it's not as expensive and it's non-invasive. So they're like, I'm going to sit on a chair and it's going to work.
hokey.
But yes.
So this ab one, if I just want stronger muscles in my stomach,
Yes.
It's going to do the work for us.
if I need my glutes lifted, you're saying it helps?
It does help. So I'm just going to tell everyone right now,
gosh, that's crazy.
if you have a great physique, it's going to enhance that, right? You're going to get a 6-pack. But for me, I'm never going to get a 6-pack from this machine. So I don't want anyone coming in thinking they're going to
Like
get
this is their makeover, their mommy makeover.
Yes, exactly. So, but it goes really down deep, and it can decrease your visceral fat, like that really heavy fat above your muscle, by 19%, and it increases muscle mass up to 30%.
Wow.
Yeah.
That is incredible.
This is
Yeah.
a fun,
Right.
fun
So
information.
what about, is there a side effect like for weight loss? Like,
So You know, this kind of
An IV for weight loss and sit on the chair.
Well, there's shots now,
yeah.
pills. So.
Yeah, and we do the semaglutide and tirzepatide as well, and this can go with it also. The owner of the salon that I rent a couple of rooms out of, she actually does lymphatic drainage. So we have been incorporating both because they suggest you can do this, and then the lymphatic drainage helps get all that fat moving out where it needs to be instead of setting in the body.
My gosh, you have all the things.
All the secrets.
Right?
I feel like we should maybe get set up. Pete.
Yes,
Merry
yes,
Christmas.
yes.
Maybe
Maybe
you
there's
guys
a
are always
sponsorship.
welcome. That's the cool thing. I feel so confident in my machines and what I do that you get to come, you get a free consultation. I let you try the machines before you commit so that you can actually see like, oh my gosh, like these really work. So I don't want you to pay
Yes,
for
you
anything.
should have a lineup. I mean,
Yeah.
everybody should be like any woman trying to do like 20 Kegels by themselves. Like, and there's a chair that will do it for
At the
you.
stoplight.
Amen. Right.
Yep.
Right.
Yeah.
And you're right. Like nobody talks about it. So
Yeah,
like,
it's
I
true.
love that you're offering these services.
Yeah.
Yes.
Can't you tell everyone where you're located now?
So I'm actually just right next to where MVP used to be to the
okay.
north.
Okay.
So on the door it says Bloom Theory.
Yep.
So I'm downstairs, so don't go upstairs, but just right in there. I have a couple rooms. One of my rooms we actually just put in massage chairs. We got Osaki massage chairs. They scan your body and they learn the curves of your body, and then that helps when you massage it. And then I have a oxygen bar that you can pick from for some aromatherapy. Now when I say oxygen, it's the oxygen concentrator. I don't want anyone to think I'm giving medicine out without a doctor's prescription. So yeah, and it just has aromatherapy. We've had kids from the high school walk down. I have a little Keurig there. You can get some tea, hot chocolate, coffee, whatever. Sit back in the chair, get a massage, have the oxygen on, relax. And then my next room has all my I also do teeth whitening. One other cool thing that I've incorporated as well, I work with a doctor out of Texas. His name is Dr. Darcy, and we do stem cell infusions for people who have injuries that need to be healed. So I've done that with some BYU athletes. Also want to preface that with that this isn't an FDA approved treatment. However, the FDA does follow us. So we aren't using, you know, the unapproved stem cells. So, because there's a lot of controversy around this, but this is actually the stem cells that the FDA and approves of. So,
You
Wow,
are
so
Yeah,
many
you really
things.
do have it all.
knowledgeable and have so many awesome things.
Website.
yes. So ivrestorativeCare.com. That'll list all the treatments that we do, the stem cells, teeth whitening, the machines. It'll have my chairs on there. You're welcome just to call. You're also welcome just to walk in. If we're there, come in, just sit in the chair. You don't have to make an appointment.
You're awesome.
You've got, like,
Thank you so
everything.
much.
Best
Right?
of luck
Yes.
to you.
Thank you.
Yeah,
Keep it up.
thank you.